Proven techniques to restore normal heart rhythm. Hello everyone. Welcome to our YouTube video on paroxysmal supraventricular tachycardia, PSVT, and the vagal maneuvers that can help manage this condition. Did you know that PSVT affects an estimated 2 to 3% of the general population? PSVT is more common than you might think, and knowing how to respond can make a significant difference in your well-being. In this video, we will explore PSVT in more detail, including its causes, symptoms, and effective vagal maneuvers that you can use to control and potentially stop an episode. So, let's dive in and empower ourselves with knowledge to tackle PSVT head-on. But before we continue, let's take a moment to understand what PSVT is and how it can affect our lives. PSVT is a condition characterized by episodes of rapid heart rate that start and stop suddenly. During these episodes, you may feel your heart pounding, racing, or beating very fast. It can be an unpleasant and alarming sensation, but it's essential to stay calm and remember that PSVT episodes are usually not life-threatening. There are several potential causes of PSVT. It can be triggered by factors such as anxiety, stress, caffeine intake, alcohol, smoking, certain medications, and even hormonal changes during pregnancy. In some cases, underlying heart conditions like heart failure, valvular heart disease, mitral valve prolapse, or cardiomyopathy may contribute to PSVT episodes. How to recognize PSVT? Before we dive into the vagal maneuvers, it's crucial to be able to recognize PSVT. If you experience sudden onset palpitations, a rapid heart rate, and an uncomfortable sensation in your chest, it's important to consider the possibility of PSVT. However, only a medical professional can provide a definitive diagnosis, so it's recommended to seek medical evaluation for accurate diagnosis and appropriate treatment. The vagal maneuvers are often the first line of intervention for tachycardia. Vagal maneuvers are simple techniques that can help stimulate the vagus nerve, which plays a role in regulating heart rate. These maneuvers aim to slow down the heart rate and potentially terminate the PSVT episode. Here are 4 commonly used vagal maneuvers. The Valsalva maneuver is a quick, non-invasive method for a fast heart rhythm called supraventricular tachycardia, SVT. It's sometimes the first choice of treatment before trying medicine or another procedure to get your heart rhythm back to normal. To do the Valsalva maneuver, you push air out, but with your nose and mouth closed, like having a bowel movement. You should do the Valsalva maneuver after your provider gives you instructions. They'll also know if you have the type of abnormal heart rhythm that responds to this maneuver. How to perform the Valsalva maneuver? Sit down or lie on your back. Take a breath. Push that breath out against your closed mouth and nose while straining as if you're trying to poop. Hold for 15 to 20 seconds. Hold for 15 to 20 seconds. Open your nose or mouth and breathe out. In the modified Valsalva maneuver, your provider raises your legs right after you stop straining. This version may work better than the standard Valsalva maneuver. One study found the standard method worked for 16% of people, while the modified version worked for 46% of people. It may work better because having your legs up helps more blood come back to your heart. In the reverse Valsalva maneuver, you sit and inhale for 10 seconds with your nose and mouth closed. Your healthcare provider can use the Valsalva maneuver to diagnose you or treat you. The Valsalva maneuver can slow down your heart rate and stop supraventricular tachycardia, SVT, an abnormal heart rhythm. Help your provider decide which kind of heart murmur you have. Tell your provider if you have heart failure. Help diagnose other problems, such as venous, vein, disease or a varicocele, a swollen vein in your scrotum. Help diagnose an issue with your autonomic nervous system, which controls your heartbeat, breathing and other functions without you thinking about it. Get something out of your middle ear that shouldn't be there. If a Valsalva maneuver is successful, which happens 5% to 20% of the time, your fast heart rate will slow down in about 1 minute. If it doesn't stop your supraventricular tachycardia after 3 tries, your healthcare provider will proceed with the next steps in treatment. These steps may include carotid massage, medications or electric cardioversion depending on your symptoms, vital signs and the type of supraventricular tachycardia. Who should avoid the Valsalva maneuver? Because the Valsalva maneuver increases pressure in your eyes and belly, you shouldn't do this maneuver if you have retinopathy, a problem with blood vessels in the retina of your eye, and intraocular lens implants in your eyes, such as after cataract surgery. You need to be careful with the Valsalva maneuver if you have heart valve disease, coronary artery disease, congenital, since birth, heart disease. Another vagal maneuver is carotid sinus massage. Locate the carotid artery on the side of your neck and gently apply pressure with your fingertips for 5 to 10 seconds. Be cautious not to apply excessive pressure to avoid blocking blood flow. For some individuals, immersing the head in cold water can have a vagal effect. When experiencing PSVT, splash cold water on your face or immerse your face in a basin of cold water for a few seconds. The cold stimulus can stimulate the vagus nerve and potentially slow down the heart rate. In some cases, coughing can be helpful. Perform forceful coughing to increase intrathoracic pressure. This can help stimulate the vagus nerve and restore normal heart rhythm. It's crucial to remember that vagal maneuvers may not be effective for everyone, and their success rates can vary. Additionally, vagal maneuvers should only be attempted after consulting with a medical professional or under their guidance. If you're uncertain about performing these techniques or if your symptoms persist or worsen, it's important to seek medical attention promptly. Remember, this video is intended to provide guidance in emergency situations, but it's not a substitute for professional medical advice. If you experience PSVT or any heart-related symptoms, please consult a healthcare professional for a proper diagnosis and personalized treatment plan. Every individual is unique, and it's important to receive appropriate medical care tailored to your specific needs. By understanding PSVT and learning about vagal maneuvers, you can be better prepared to manage episodes and potentially regain control of your heart rhythm. However, it's crucial to remember that this video is not a substitute for professional medical advice. If you or someone you know experiences PSVT or any heart-related symptoms, such as chest pain, dizziness, or shortness of breath, it's essential to seek medical attention promptly. Your health and well-being should always be a top priority, so reach out to a healthcare provider who can provide a comprehensive evaluation, accurate diagnosis, and appropriate treatment options based on your individual circumstances. Before we wrap up, we would like to express our gratitude and kindly ask for your support. If you found this video helpful, we would greatly appreciate it if you could show your support by giving it a thumbs up and clicking the notification bell. By doing so, you'll stay updated with our latest content, and together, we can reach and help more people who may benefit from this valuable information. Your support means the world to us. Thank you for watching, and don't forget to subscribe to our channel for more informative content. Take care of your heart, stay informed, stay proactive, and most importantly, stay healthy.